Hi, I'm Dr. Andrew Tharp with the Vision Care Center in Evansville, Indiana. Sometimes, when talking to patients about cataract surgery, they're surprised to learn that they need an implant with their surgery. Patients don't always understand that though their cataract is causing them blurry vision, it's also still a part of their natural lens of their eye, which still does provide some function. When we perform cataract surgery, if we take the cataract out, we have to put something back in for the eye to function properly. This requires the use of an intraocular lens implant. Intraocular lens implants provide a number of opportunities for vision correction. Sort of like the power that's in your glasses or your contact lens, we can manipulate the power of an intraocular lens implant to reduce dependence on glasses after cataract surgery. Not only can the power of the implant be manipulated, but so also can the optics, so that some implants will provide greater correction for near, distance, and intermediate. These are referred to as bifocal or even multifocal or extended depth of focus implants. Some patients will opt for these with their cataract surgery to reduce their dependence on glasses. Another question that I'll get when talking to patients about cataract surgery is how long will their implant last? When we perform cataract surgery, we're performing lifelong surgery. When we place the implant in the eye, we intend that to last for the patient's lifetime.